Welcome to the Pediatric Epilepsy Podcast. I'm Christy Grease, your host. My co-host, Dario Herrera. Welcome.
Hi, Christy.
Hi. I was waiting for that. And we're so excited to have a new member of our medical advisory board, somebody we've partnered with in the past to help educate our families. And this is Janelle Wagner, who has dedicated the last 17 years of her life to behavioral health assessment and intervention and self and family management in the pediatric epilepsy setting. She has been funded by the Epilepsy Foundation and the CDC and has had over 95 peer-reviewed publications. And because Dr. Wagner knows no limits, she also achieved her PhD in clinical psychology from Oklahoma State University. She completed her postdoctoral fellowship in pediatric psychology at the Medical University of Southern Carolina, where she is currently a research associate professor. She's held leadership positions in international epilepsy professional communities. And she also enjoys traveling, watching her boys play soccer, like me, yoga too. I love yoga, and participating in her book club. Welcome, Dr. Wagner. We're so excited to have you.
Thank you so much. I'm delighted to be here.
Well, I know that you have always been a wealth of knowledge, and, being a guest on the Pediatric Epilepsy Podcast right now is very timely, because this month is Mental Health Awareness Month, and we really wanted to bring you on the podcast so that we can highlight the importance of mental health, specifically for the epilepsy and neurology communities. And I know firsthand the kind of mental health impact having a child with epilepsy has. I have so many moments where I just was ill prepared for what I had on my plate. And, we just recently saw one of our warriors, so special to us in the epilepsy community, baby Ozzy, pass away. And we're watching his mother deal with the grief. And then we've also just watched another one of our warrior babies have a comprehensive epilepsy surgery. And I know firsthand what that feels like and how unexpected that was. So I was just hoping that we could dive right in, and, we've talked about the mental health impact on, both the family and the child with epilepsy. And I know that you had personal experience with your brother having epilepsy growing up. We'd love for you to just share your thoughts about, with our audience about what it takes and what comes to mind when you're thinking about mental health, specifically in the epilepsy community.
Sure. Well, I really appreciate that you are so, adamant about including this in the podcast, because sometimes I think we get so focused on seizures and seizure outcomes to the detriment of sort of taking the comprehensive approach to the whole child and family. And as you mentioned, yes, I do have a personal experience with epilepsy. My younger brother, who was 3 years younger than me, was diagnosed with complex partial seizures when he was 10 years old. And he continued to have seizures until he was 20, when he had a partial temporal lobectomy, which actually did cure his epilepsy. But he spent the next 10 years, which are the school years, with a lot of difficulties at school, really struggled with depression and sort of loneliness, but at the same time felt very stigmatized and was adamant that our family not share with others, and he did not share with peers that he had epilepsy. And this was in the late 80s, early 90s, and I do feel like we've come a ways since then, in that there are a lot more supports available for families. Thankfully, social media and just the connections that families can make. I grew up in a smaller town in Oklahoma, and there just weren't any, resources. And so if we'd had the internet and, social media, the ability to make those connections, I think would have been vital for my family. So yes, when I went to graduate school, I basically told my mentor professor, I want to work in pediatric epilepsy, and here's why. So I basically went around, when I got to MUSC as an intern, I just started knocking on people's doors, writing emails, and said, I want to work with pediatric epilepsy population. And they welcomed me, because there was no one, there. And at the time, there were very few psychologists. There were a lot of nurses who had dedicated their careers to the mental health aspects, but we really did not have very many psychologists who were not neuropsychologists focused on, the cognitive evaluation piece. So it's been really cool to see how far we've come in the last 17 years, although I still feel some days like we have so far to go.
Exactly.
Because we are still a little behind some of the other pediatric chronic illness conditions with the research and what we know about mental health, and then just what the interventions are that we have.
I always say that. Dario hears me say it all the time on calls, that I want families to react to epilepsy like they just got a cancer diagnosis. And I think that you're so right. I mean, I remember just going through this blind. I remember getting the infantile spasm diagnosis for Michaela, going, why hadn't I heard about this? And then when I came home from the hospital, that's when even though my baby came back from surgery and was seizure free, my whole world collapsed, because I said, why did this happen? And then B, after that, I wanted everything. I didn't realize I was trying to make everything in my world be perfect so that my daughter wouldn't die. I mean, that's like how deep in the recesses the trauma is from having a child, going through that. And then then going to the hospital again for follow-up treatments, where you remember that room where she had the brain surgery, or where the doctor said this, and the sights and the sounds. So what was your experience watching your parents go through this?
It was hard. I was the, older sibling, so I sort of had that birth order protective, sense. I also struggled sometimes, if I'm going to be completely honest, with feeling like epilepsy ruled our lives. Like I wasn't able to talk about my grades at school because school was easy for me and school was really hard for him.
Dr. Wagner, how old were you? Your brother was 10 when he was diagnosed. How old were you?
13.
Okay, so you're still young. Now you feel kind of the weight of the world on your shoulders at 13 years old.
Yeah. So, I feel like, and I was the one that witnessed a number of his convulsive seizures, and it was very scary, because he made sounds that he didn't typically make. He, then lost consciousness, and he, was convulsing. And so I knew what to do, but it was still just he didn't seem like Aaron when, he was having seizures. It was almost like dealing with another being, because he almost didn't, there just wasn't that personality. There wasn't that, all the characteristics that I would, typically associate with my brother. And then I watched my parents, I think, and they talked more about this later, not so much to put the burden on me as a teenager, but just they had many sleepless nights. They worried a lot, and then when he went through the older teenage years and actually started having more seizures again around the age of 18, 19, so he couldn't drive, but he still wanted his independence. So he'd want to take walks, and teenagers are night owls. So he'd want to take a walk at night with his dog. And then my mom would worry that he was going to be in a ditch somewhere, or that he wasn't going to come home, or he was going to get disoriented, so they were really trying to balance that. How much independence can we give him, and how much safety, supervision, concern, do we need to have as well? And he would get very upset with us because, if he would yawn or do anything that reminded us of sort of the onset of one of his seizures, we'd all sort of just like swivel very, are you okay? And he was like, I'm fine, leave me alone.
Yeah.
So he was responding to our increased attentiveness to those things as well. So I definitely think, you mentioned trauma, that there are some of those symptoms that we have when we go through those experiences. And then when you're reminded of those cues, when something sounds like that, or you're in a setting where a seizure took place, it does bring back just sort of that flood of emotional and physiological responses to that.
And it's not something that you're expecting. I mean, I think that's the thing. There's so many people, like myself included, who were able to kind of Jedi mind trick this situation, and you know something's happening, or you know something that's going to trigger you, so you prepare ahead of time. But my experience with going, and I can't even imagine families that are in the hospital constantly, I wasn't expecting it. So that even took that was even more difficult, because I had no control of all these emotions that I felt in those times that I was triggered.
Yeah.
Dr. Wagner, and to you, Christy, too, I wonder how does that mental health impact translate to, like physical or physiological reality, right? Because, we know that there's a relationship between what's happening externally, what's happening internally. So I wonder how some of those symptoms that you described, Dr. Wagner, manifest themselves physically, and, increased anxiety. Is it less sleep? Is it, what's happening? Because I think I want our listeners our viewers to know, like, what's happening mentally, but also how does that impact you, in the way you live your life and go about your day,
Yeah. And I think exactly like you said, I mean, for some people it affects sleep. Some people have dreams about it too. So they re-experience it, in a dream. Some people re-experience it just in, a thought during the day, in the images that are associated with that. People report, and we see, sort of just increased muscle tension. And, for some people, anxiety really does seem to manifest in bodily form. For others, it's more mental, where there's just constant worry about it. Worry, are they going to be okay at school today? Should I pick them up early? What if the school doesn't call? What if somebody doesn't see it? What if the other kids make fun of my kids? I mean, there's so many of those cognitive pieces that go on too, and I feel like parents are often trying to balance this with the desire for their child to have as typical a life as possible. Yeah. Right? Every parent wants their child to have friends and be accepted and enjoy, learn and enjoy things and be able to run and kick a ball. And for some parents, those dreams aren't able to come true. But for many parents, you're balancing that with kind of what's going on in your everyday life, how your body is feeling the stress and trauma of all of this. And I think most parents don't recognize on a daily basis the mental and physical load that, something like epilepsy can have on a parent, because you're just putting one foot in front of the other. You're just doing what you have to do to get your kids to school, to get them to take their medication, to get them to the treatments and the therapies that they need to take care of your other children. I think parents also deal with a lot of guilt over the lack of attention they feel that they have for their other children.
Yes.
And so, that's a very, and then siblings have feelings, about this too. Some of them are resentful of, the fact that they feel like sometimes their sibling is treated differently, or maybe the consequences aren't as hard for that child as they are when a different child gets in trouble, or maybe they feel like everything is about the child with epilepsy and no one notices when they need something or they accomplish something. And so, you see sort of all of this going on in the family dynamics, and most people, again, don't realize and aren't processing all of this because they're just kind of living daily life. And it really takes someone to help them kind of step back and unpack this, because otherwise it seems too emotionally overwhelming, because it's one more thing that you've got to process throughout the day with all of your sort of regular duties.
I am so relating to everything you're saying. I know Gabe and I have spent so much time thinking about Preston. In particular, Harrison, now didn't know. I mean, he was, 2 years. Harrison's 6 and Michaela's 9. So we took some time until we even decided we were going to have a third. But so much time was spent thinking about Preston, and I didn't want him to be resentful, like you said, and I didn't want him to feel like what he did. Sometimes I look at Mickey's accomplishments in her development, and when she was younger, making these big strides, we would always cheer that. But then Preston, being quite intelligent and just doing so well, we realized like sometimes we didn't recognize or acknowledge. And so we really made a point to acknowledge all his little steps, that and his developmental milestones, because that really took a lot. That takes a big toll on families worrying about the siblings and that they're cared for, because the bottom line is my mom became buddies with Preston. She was his caretaker all those months and days that we spent in the hospital. And I heard you say we've heard grief, we've heard anxiety, trauma. What are the other comorbidities of epilepsy? And then what are the different avenues and support that our families can look out for? What are the things that we should be kind of educating our families on, opportunities for them to have support?
Sure. So, I mean, in terms of kids, so we know that kids with epilepsy, 50% will experience behavioral health and or developmental cognitive comorbidities. So that's really high compared to other chronic conditions, but it does make sense given that seizures originate in the brain, and so does learning and behavior and emotions and mood. And so, it's really important for kids to get baseline evaluations, not just neuropsych evaluations for the cognitive and learning piece, but also behavioral health interventions for, aggressive behaviors, for, depression, anxiety, autism spectrum behaviors. I mean, there's so many different things that we want to consider. And then it's really important to do that before even they're started on medication or other treatments if possible, because some of those treatments can also cause either improvements or exacerbations in those symptoms. And so we want to have a really good timeline of, when the symptoms started and maybe what factors, because I get the question all the time, well, is this the epilepsy or is this just my child?
Right.
Exactly.
It's a really hard question to answer, and for many kids with epilepsy, there were learning or behavior problems that preceded the onset of the epilepsy diagnosis. So, we really view epilepsy as a much broader disease than just seizures, because it is brain-based and there's so much going on in the brain. And then you take a developing brain on top of that. And that just sort of adds some complexity to that too. So, screening is really important. We are starting to get better about this, during routine epilepsy care, because not everyone has access to a behavioral health professional. So I spend a lot of time advocating and educating, like at the American Epilepsy Society, at the Society of Pediatric Psychologists, different national scientific organizations, even International League Against Epilepsy. We have a presentation this summer on suicide, but looking at how can you incorporate routine screening into an epilepsy visit? And then what do you do with that information? Because a lot of the providers are like, great, I'm willing to do that, but then I open up a can of worms and what do I do? So it's knowing what resources you have as a provider to refer to, kind of what's in your community. And for each person, it's going to be different, and each practice, it's going to be different. But really trying to improve screening. And having families then also perceive that as part of their epilepsy care, right? So we have stigma with epilepsy, we have stigma with mental health. So you kind of have a double stigma when you put them together for some families. So really getting people to understand that this is part of the epilepsy. In some ways, it's not surprising to us that your child is also having trouble in these other areas too. And so it's normalizing for people. You're not alone. I think once we can take out that isolating piece and that feeling of loneliness and say, normalize for them, that's a huge part of psychoeducation in helping families understand, both of these are brain-based. This is what we would typically expect in a child of this developmental level. What your child is experiencing is not different from what other kids, with the similar behaviors and symptoms also experience. But then it's beyond that to the parents. And I feel like this is where sometimes it can be kind of tricky. And I actually attended a conference about a month ago where we were talking, someone was presenting on the ethics of treating parents in pediatric settings, right? So if you're in a pediatric hospital, the child is the patient, but we all know that the family is very much involved with what's going on. And so it does sometimes present some difficulties for providers in trying to then also provide supports to the caregivers, because the caregiver is not your patient, the child is. And to some degree, you do have to document in the medical record what you've done, but you don't want to document private information for the caregiver because the caregiver is also not the patient. So I say all of that just to, say that, people may have had different experiences with that, and we're starting to sort of try to tease through the bioethics of that and how we can provide family-based care for kids and do it ethically and document everything that needs to be done. And so that's where certainly some of the advocacy organizations come into play, because if you're a provider and I can refer these caregivers here, I can set them up with a peer mentor to help them, or a peer navigator to kind of help them through this process, if that's something that's available in your area. It's attending to it, but also knowing that as a pediatric provider, you can't help solve that for the parent. And it's knowing what level of care is needed. For some parents, it is just hooking them into a community and letting them know what resources are out there. But we do know from the research that, a large number of parents of kids with epilepsy struggle with anxiety and depression, marital difficulties, family discord, for all of the reasons that we talked about earlier. And so if you do have a parent that you feel like is struggling more than would be helpful with just resources, knowing where to refer them and how to incorporate that into the child's visit is also important too, because you want the parent to feel heard. You want to acknowledge those things. But again, there is sort of all this other stuff going on that you're trying to, the child is the patient, but you can't really treat kids outside the context of the family either.
Eduardo, I have a follow-up question. Our audience is really made up of two segments. One is primarily caregivers, right, parents, and the other are folks who provide treatment, and those sometimes, from my experience, it can be at odds with one another, right? So we've heard either pediatricians or pediatric neurologists or even epileptologists, they have a massive caseload. There's huge demands on their time, so they don't always have the time to get into the background, understand the holistic nature of what the family's dealing with or what the child's dealing with. So if you could give advice to our parents who are in the audience listening to this, how do they approach the subject of mental health with the primary caregiver? The primary treatment doctor, so that they incorporate that into the holistic approach to how they're dealing with pediatric epilepsy.
And I have a follow-up before you answer that. And who is that provider? Is it, sometimes we'll say, what's your relationship with the pediatrician, or is it with the epileptologist? Right. Who is the family going to ask that question?
Sure. And those are great questions. So, sometimes kids do see pediatric epileptologists. Sometimes they do see primary care. In states that have large rural areas, sometimes they'll be diagnosed, set on a treatment regimen by the epilepsy center, and then be cared for in between by, primary care. And so, I think that it really does depend sometimes on the setting and kind of what is available in that area. Obviously, I would love for there to be a pediatric psychologist in every pediatrician's office and every pediatric neurology office, because then there's a handoff, right? So no one's expected to do all of it, right? Because as you mentioned, there's time issues, there's, people have huge patient loads, there's areas of expertise, right? So providers might feel comfortable screening, but not treating mental health in kids with pediatric epilepsy, or, caregivers either. And so being able to have that handoff is so important. So that's where I see it's important for us to continue educating the larger community. So that doesn't mean that mental health providers can't be trained to work with families with pediatric epilepsy. And so, kind of what we're trying to do on some of these national fronts is really increase the education and training that's available to community mental health workers or people in private practice that aren't necessarily affiliated with the epilepsy center or, the primary care practice, in case those, behavioral health professionals aren't there. my encouragement to parents would be ask, bring it up. The only way, if it's not something that's being addressed routinely in a epilepsy visit, then bring it up.
What's the question? I want to know specifically, what's the question? What do they say?
Exactly.
Like, if you're a parent and you're in front of a provider, regardless of setting, whether it's urban or rural, or if it's a neurologist or a pediatrician, what's that question a parent can ask to make sure mental health is part of the equation?
I think just simply saying, I have some questions and concerns about, and say whatever that specifically is for that child, school, maybe they're having difficulty at school, or I've noticed that she's really anxious or nervous about things, or she's not wanting to go certain places because she's worried about what's going to happen, or she's going to have a seizure when she gets there. So I would say bring it up in the specific context for your particular situation, because one, they're going to recognize, okay, not only has this parent identified this as something that's important, but they're telling me it's happening in their child, right? Or they're asking about a specific, just like when you go in, they ask you, how many seizures have you had since the last time? Are you still taking your medication? Through all of those things. So then say, I have some questions and some things that I would like to address today too, in addition to the seizures. And they are having difficulties at school, seems really down or sad a lot lately, those types of things. And say, I know that this can be common in kids with seizures, and I want to see what can we do. So I think that bringing it up and then saying, what can we do? How can you help us with this? Really provides a question and an opportunity that can't be ignored.
Thank you.
Awesome. That's so helpful. I feel like I need to schedule a session with you because you brought up things, and that was going to be my last question is, in your dream world, what would you have families like mine go through therapy, when they have a child with epilepsy or a child with neurological, a difficult neurological journey? I mean, what would be like the dream reality for these families if money and time weren't, a consideration?
I was just going to say, if money, time, and access were not
have a vision.
Right.
Then yes, I do think that it's helpful because, and the reason I say that is not to just say, everyone needs mental health services or, everyone should get it. But it's because we do have data showing that even in families that aren't expressing significant anxiety or significant depression, there are just a lot of needs. There are questions. There's the need for more information or knowledge. There's questions about my child's future. There's questions about how long will, my child have to be on this medication? And some of those are somewhat rhetorical. We're not, people aren't necessarily expecting a number answer, but more of someone to help talk me through this. And that is where I feel like having those peer navigators and families who've also gone through it is helpful and important, because it is one thing to have a mental health provider say, this is typical of what we would expect in this situation and kind of normalize it for you. But it's another thing to have another mom or dad say, I've been there. I've been through this, and so I think it's a good balance too, because what you don't want new families to feel like either is that their journey is going to mirror exactly yours or someone else's, because it may be very different, and they may have some similar needs, but they may also have some very different needs. And so I feel like that's where a mental health person to check in every once in a while, to be able to just kind of say, how are you doing with this? And sometimes that's all families want, is someone to acknowledge that this is hard, that you are doing a great job. They just need to hear someone else say those things too. And so sometimes I think that can be done in a group setting. For some families, it does need to be more individual, but in an ideal world, like I said, this would all be treated the same way that seizures are, right? Like we would never think about treating epilepsy without an epileptologist or without an MRI and the radiologist to read that. So if we know that 50% of our kids struggle with these things, then we should be thinking about mental health as just as important as the rest of those things, because there are at least some studies in the adult world showing that if you treat the mental health symptoms, the seizures actually improve.
Right.
Wow.
Right? So it's not just that we're treating seizures. If we're treating the mental health disorders and symptoms, then the seizures may improve as well.
That's the exclamation point on this conversation. The fact that
Absolutely.
if you treat mental health, the physical aspects of pediatric epilepsy get better.
Absolutely. And I mean, I would even say in that example, sure, we say it's mental health, but there are a lot of physical brain-based aspects of mental health too. Right. And when we kind of go back to the underpinnings of seizures, of behavior and mood, and how all of this is connected, then it does make sense that if we're treating one, the other could possibly improve too.
Yeah.
Well, I was just going to say, it's like sleep deprivation is, I believe one of our doctors said number one cause of a seizure. Imagine not, I know when I have anxiety or things are happening, I can't sleep. So yeah, absolutely. It makes sense that we address that. I think what we're providing even right now is just the openness and the opening for the conversation and how important it is. And I wish I had been told, hey, you might want to get a therapist. Even though Mickey's seizure free, there's still stuff that, even to this day come up. And I really want to make sure are dealt with appropriately so that, I'm not dealing with something 20, and there'll always be a little tinge of that. I think I just want to make sure that our families have the coping mechanisms to deal with it. And Dario knows one of the most important things we do is connect families. And I'm very careful about how we coach it in the sense of, hey, you guys have similar situations. They're not the same. You both have different journeys. You could have different outcomes, but hey, there's somebody else who's been through this. And it has been so healing for so many of our families. They'll call me and say, oh, I didn't know anybody else had gone through this. And there was so much shame and blame put on themselves that they did something wrong, which I can relate with. And so those answers, the diagnostic tests that you're talking about, also give families the reassurance of knowing, like, you didn't do anything wrong. And I'm telling you firsthand, I thought I'd done something wrong when I was pregnant with Mickey or something. And then we realized it's just her genetics. It's just, the way her chromosomes were, she ended up having an abnormal formation of her brain, and it wasn't me. And so I think it's so important that these families ask for these testing, ask these questions, open that conversation with families, because, doctors, like you said, they need to, they're so brilliant, but they have so much on their, they're just loaded with work and time constraints that I feel like all the things that you shared today really help our parents just have a better idea of how they can be in relationship with their child's physician.
And for them to realize how normal mental health impact and mental health issues as a part of this full context is, right? It's not unique. Most families dealing with a child with epilepsy is having some kind of impact, whether it's anxiety, whether it's stress, whether it's lack of sleep, whether it's PTSD, fill in the blank, it is normal.
Yes.
Right. Yeah. And that's not just is it important, but it is normal. And it's part of the shared journey. Everyone's situation is different. Everyone's symptoms are different. How they manifest, mental health impact, is different. But the impact is there, and it's part of the shared journey that is very normal. And from my experience dealing with parents and with observing Christy dropping off Mickey and knowing she couldn't go into the hospital because of COVID, and seeing her physical response to that. I mean, it wasn't just a mental response to that. I saw the mental wear, translate into physical impact. That all of that is normal. And the more we talk about it, and the more we are open about it and share about it, and teach parents what questions to ask, I think the more advancement we can make in this mental health conversation, because obviously it is a very critical part of dealing with the holistic approach to pediatric epilepsy, including families.
Sure. And I was just going to say one thing. Christy sort of brought up the uncertainty of everything, right? So many families deal with the uncertainty of when is the next seizure going to occur? Where is it going to occur? Who's going to be present? Is someone going to be able to take care of it? So there's the uncertainty. You can take your medicine or your other treatments exactly as prescribed and still have seizures. So there's also that, where what you're doing is not always affecting the outcome. And so that's hard for us as humans. And when we look at human behavior, we expect that if we do something that we know will help or control a situation, that we'll get a positive outcome. That's not always the case for families. We have a number of kids, 40% of kids that are not able to be controlled with 1, 2, 3, seizure medications.
Thank you so much, Dr. Wagner. We appreciate you. We appreciate your voice.
Absolutely.
I was just telling Dario earlier today that I appreciated how intelligent and well-versed you are, how educated you are, yet you're so approachable. And I really, as a special needs parent, as a parent of a child with epilepsy, now seizure-free for 7 years, I just want to thank you. And we're so honored to have you on the medical advisory board and excited to see everything that comes from that, and just wish you so much success in everything you do, and the addition and the part that you play in this community and in this world is so important, and we appreciate you for it. So thank you for being on here.
Yeah, I want to thank you too. I mean, with your accolades and with your background, you could do anything. And the fact that you've dedicated your life to serving families who have children with epilepsy and helping them cope with some of the most difficult parts of the journey and experience is incredibly meaningful. And as the executive director of Mickey's Miracles, who gets to have the honor of working with these families on behalf of all our families, and Christy, our board of directors, Mickey, even, we thank you. We know you could do anything you wanted to do. And the fact that you've chosen to do this is something that we share gratitude for.
Well, I appreciate it so much. It really is an honor to be part of what you all do. And I, as a family member who has personal experience with epilepsy, that's very meaningful to me that you all are just really trying to network families and reach out to them and help them not feel so isolated, and that they get the right information about epilepsy and get connected to families. So I'm delighted to be part of this. Thank you so much for having me on today.
And with that, we'll conclude this episode of the Pediatric Epilepsy Podcast. Put all your notes, any questions that you have for Dr. Wagner. We know how to reach her. So if you have any further questions or any other topics for our podcast that you'd like us to focus our attention on, please let us know. And with that, be well.